Okay, so good morning, Dr. Caitlin. I've got Dr. Caitlin here on our Skype. I'm super excited to be talking to you today. I thought maybe you could just start by introducing yourself a little bit. Tell us who you are and how you help these women. Yeah.
So I'm Dr. Caitlin O'Connor. I'm a naturopathic doctor that specializes in women's health and pediatrics. So I only see women and kiddos in my practice.
Awesome.
I'm in Denver. I've been there in my sort of clinic for about the last 10 years or so. So it's nice to kind of get some good clinical years under my belt. It's helpful to see what actually works, what doesn't work, what's challenging for people. I trained as a midwife, so I did midwifery training as part of a sub-program in my ND training, which really gave me a lot of insight into women's health throughout the reproductive life cycle. I don't practice as a midwife anymore, but I work closely with a lot of midwives. So I get to see folks sort of during preconception, prenatal, pregnancy, postpartum, all that stuff. So that's what I do.
Oh, awesome. I'm so happy to hear that. So I actually found you online. You're local here and you're in Denver, right? So we're not too far from one another.
No,
I'm up in Boulder, and I've seen that you obviously have a big passion for women and women's health.
Yeah.
And I've got a lot of women that I'm working with right now who are suffering specifically from, anywhere along the different journey of just finding out that they got an abnormal pap and they're freaking out.
Yeah.
Or maybe they've already gone through sort of the cycle of abnormal pap followed by a colposcopy, followed by biopsy, and now they're trying to figure out what to do next. So I'm curious what your experience is with women who get abnormal pap smears or high-risk HPV diagnoses, and how it is that you work with these women.
Perfect. The first thing I tell people is to take a deep breath and mostly not worry about it, right? Not that we don't have to be proactive, but I think the first thing that happens when people get an abnormal pap or they get a high-risk HPV and the pap is still normal, or maybe they're referred for colposcopy, there's a lot of different diagnostic possibilities, is that there's a lot of fear, and I feel like there's a lot of shame. So people get really worked up about not only feeling scared that they're going to develop sort of a aggressive type of cervical cancer, but also a little bit of shame of this is, caused by HPV, and HPV is a sexually transmitted infection. And we have so much shame and embarrassment and worry about this virus that it's kind of, there's a colleague of mine that just calls it the common cold of the cervix, right? HPV to me is sort of almost the price of admission for being sexually active. Almost everybody's going to be exposed to some strain at some time. And 90% of folks that have an exposure are going to clear it 100% just doing nothing, watching and waiting. And I think a lot of that fear and kind of feeling scared or feeling embarrassed gets people in this spiral of stress, which certainly isn't going to help their healing. And I think there's a difference between making choices from a place of fear versus a place of empowered knowledge. So what I really start with people is kind of laying out all the facts, what were your test results? Are you a good candidate for sort of watch and wait? Do we want to get a colposcopy and sort of see where we are? Educating people about what is HPV? It's just a virus, but it's a virus that affects, our reproductive tract or sort of the genital area. And because our culture is just kind of a little weird and doesn't really have, I think, a great sort of healthy approach to sexuality, especially women's sexuality.
Yeah.
It's everybody shuts down and feels oh my God, this is this big, scary, shameful thing. I have this HPV virus. And it's you know what? It's just a virus that happens to live in the reproductive tract, but it's not necessarily better or worse than all the sorts of different viruses that sort of we're exposed to. And given the right set of circumstances, most folks are going to be able to clear it. And for those 10% of folks that body sort of gets more into that chronic HPV state, or they are developing some cervical cell abnormalities, there's a lot we can do to sort of bring the body back into a place of balance. Because I think it's really, well, all right, am I back?
Yeah.
I think it's really more of a sign of an immune system imbalance or potential like nutritional imbalance, or even sometimes, you know, a sign that there's too much stress, or you're not getting enough sleep, or there's sort of other risk factors. So I really start from a place of like education and also sort of destigmatization. Because I think that's sort of my first step is I want my patients to feel like, no big deal, we've got this, calm, centered, and like, let's move forward with our treatment plan, not in this like spiraled, freaked out sort of way. Like, oh my God, I have to do everything all at once because I have this terrible sort of virus. But like, what's going to work best for you? Let's start with foundational things. Look at what your individual risk factors might be. What can we do sort of lifestyle wise? And then individualize a treatment plan that's kind of, I always like to do sort of the least I can get away with. I want folks to, you know, not be overwhelmed by this 20-step, you know, supplement protocol and all these things. So saying like, realistically, what do we need to do? What do we think is going to be most important? But not overdoing it and not coming from a place of fear, coming from a place of like empowered knowledge. I know what's going on. I know what the mechanism is, and I know why I'm taking these steps.
I think that's an amazing first step, the destigmatization of it. Say that word. Stigmatization of it.
Yeah.
Because, you know, when you called it the common cold of the reproductive system for women, that is very cute. And I like it. And I feel like it simplifies what seems like a very big and daunting thing. I know it was even earlier just this year that I wrote my first blog post about my experience going through this 4 years ago. And I remember thinking, oh my gosh, like my aunts and uncles are going to see that I at one point had HPV. But you're right. It does sort of seem like a ticket to admission if you're in the realm of being an intimate person. Yeah, that is
part of human sexuality, is that there's these different viruses and things like that have like coexisted, and they're like, hey, can I get a ride over to this person's body? You know, like I'm just trying to like spread my DNA as well.
Right. We need more women laughing about their HPV. I think that would be helpful. It's a good therapy.
But yeah, because I think I see people who come in and they just feel so bad about it, and they feel like there's something they did wrong, or, you know, are feeling like guilt or shame about their sexuality, or, you know, having one sexual partner or 10 sexual partners. Like, it's just kind of like sort of a no big deal scenario as far as like, yep, you were exposed to it. Your body is, you know, gonna figure out what to do with it. But like, I think that first step is just releasing some of that like heaviness and some of that sort of fear and shame.
Okay, well, let's chat a little bit about what kind of protocols you utilize in your office. I know you said you like to try and get away with as little as possible. A lot of these women are very overwhelmed. So
well, that's, you know, I always say that the pros and cons of the internet is, the pros are I'm very much into, you know, self-education, patient empowerment. The downside is the vast amount of information, and the amount of information that is sometimes more like opinion based, or you know, sometimes people say, oh, I saw this one rat study with 10 sort of rats in it, and from that I've extrapolated this entire theory that I think everybody needs to do X, Y, Z. So I think it can be hard to kind of navigate like what's important to do, what might be helpful for me, versus like, I'm going to do the 100 things that I've sort of researched all at once, which I think can be overwhelming from like a financial point of view. It can be overwhelming from a amount of sort of things to gather. I think it can be overwhelming from the body. It's like everything we take in is a little piece of information, and we're not trying to like throw tons of new information all at once. I really like, and this is, you know, one of the benefits of naturopathic medicine, is looking at any condition from a point of the whole entire person. So before I even want to say, oh, I'm going to give you this like supplement for HPV, I want to do a thorough analysis of what are your foundational lifestyle habits, right? We can't out supplement as much as we'd like to. I was like, yeah, I wish there was a pill for that, but we can't out supplement our lifestyle. So much of our immune system and our immune system's ability to fight off viruses, to clear viruses, for DNA sort of replication to be monitored and working properly is based in our foundational health. So things like sleep. I'm like, okay, are you sleeping 8 to 9 hours a night? Is it easy to fall asleep? Is it easy to stay asleep? Are you sleeping in like a dark environment? Are you turning your screens off an hour before so you can make enough melatonin, which is actually a really powerful antioxidant that our body makes on its own? So sleep is a big part of it. Nutrition is huge. If you look at risk factors for HPV, there's a lot of nutrient deficiencies that can, or nutrition suboptimalness that we can see as being a risk factor. So it's like, yeah, you can take methylated folate, you can take beta carotene or vitamin A, but ideally a lot of that should be coming from diet. So I work a lot with dietary stuff, decreasing processed foods, limiting sort of simpler processed sugars, and adding in foods that we know are going to be sort of nutritional powerhouses. So I want everybody eating a few cups of leafy greens every day, rotating their leafy greens so we're not getting like the same thing every day. But, spinach, kale, arugula, I get a lot of those like power greens mixes that are like pre-washed, pre-made. You don't have to do something fancy. Cut open the bag, throw it in a skillet with like some garlic, lemon, olive oil, and just like eat your greens. You're getting the best, most active folate from those greens that you know that your body can use. Right. A lot of orange foods for beta carotene. So like sweet potatoes, squash, mushrooms. So there's a lot of research on like medicinal mushrooms or mushroom extracts, but just good old cooked mushrooms. So often I'll have women get 1 to 2 pounds of just like criminy brown mushrooms. You have to cook them to release the sort of medicinal polysaccharide components that help with the immune system.
Oh, I didn't know that. Amazing.
Yeah, raw mushrooms, you basically never want to eat raw mushrooms. Okay. You can eat them if you like them, but they're not great, and they don't, the immune stimulating component of mushrooms is broken down with heat. So you always want to use supplements that have been heat extracted, and you always want to cook your mushrooms. So I say like, hey, get 2 to 3 pounds of mushrooms per week, saute them up, eat them with your greens. Yeah. And green tea. Green tea is another huge one that has great research for sort of all sort of cellular, promoting proper cellular growth, which is when we think about like abnormal PAPs, it's basically the cervical cells are not reproducing in the healthiest way. Well, the cervical cells are, their DNA is impacted by the HPV virus. And then when they're replicating, they're kind of replicating in a funky way. They're not replicating like a nice DNA blueprint. So green tea is another one that I focus on. So I do a lot with diet. I do a lot with sleep. Stress is a huge one when we look at like stress in the immune system. So often women will be like, I had HPV a long time ago. It's been negative for like 10 years. And all of a sudden my PAP came back, with abnormal HPV this year. And I'm like, well, what's the last 3 to 6 months been like? Super stressful. I moved, I started a new job. Yeah. In this relationship that's not great. So working on that stress piece, making sure that there's time for like fun, laughter. There's really cool research on like watching like how people's immune system, how we make more white blood cells after watching like a funny movie. Oh my gosh. Like, hey, don't watch the news. Like put on a funny movie, laugh, like watch reruns of like Friends or Parks and Rec or something like fun. Make sure you're like getting involved in good community, like with women. That's why I think like groups like the support group that you have, we have that tend and befriend drive, where in times of stress, we promote more oxytocin and like calming hormones when we are in connection and community with other women. So finding that connection and community, exploring things like if we look at sort of some of the mind-body connection, like how do you feel about your sexuality? How supportive is the relationship that you're in? Some of that more energetic type of things can be important. Movement, not like, oh, I'm doing crazy, CrossFit for 2 hours a day, every day, but like, are you walking? Are you getting fresh air? Like when we think about like pelvis, like pelvic circulation and getting fresh blood flow, it's like, oh, we don't want to like sit all day long. If we're trying to sort of move and heal things in our reproductive organs, like we should be moving and circulating. So I always kind of start there. Then I look for risk factors. If people are on hormonal birth control, be it the Mirena, ring, oral birth control, those are all risk factors. It's really hard, especially for people in that 10% of folks who don't clear it on their own. We got to get rid of the hormonal birth control for sure, and talk about other options for contraception. Smoking, that's pretty obvious, but like no smoking. Smoking's a big risk factor. That's probably the number one thing in folks I've seen who haven't been able to clear HPV on their own, or folks who weren't able or interested in quitting smoking cigarettes. It's kind of like, you got to do it.
Yeah.
What are some of the other good risk factors? Smoking, hormonal birth control, stress, other medications that might be affecting digestive health and their ability to absorb nutrients. So even things like proton pump inhibitors like Zantac, Prevacid, medications for heartburn. So really what I'm looking for first is like the why. Why do we think your body was more susceptible to this viral illness? And then like, what are the foundational things we can work on first? And then from there say, okay, and what might we need from like a supplementary point of view?
Well, let's maybe dive into that just a little bit.
Yeah,
I'd love to. I know that with Dr. TORI HUDSON'S protocol, that's like a very well-known combination of like dietary changes, supplementation, suppositories, and then for some of the more severe cases, she talks a lot about escharotics in her book.
Yeah.
So
I'm interested. Oh, go ahead.
Oh, no, you're good. I wanted to maybe to extrapolate a little bit about what parts of that you may or may not use in your practice.
Yeah. And it sort of depends. It's very individualized, and it's very much based on sort of what the test results were. So somebody who it's their first time having a positive test for HPV, there's not abnormal cellular change on the pap, or it's very mild. I feel like, again, they are likely going to be in that 90% of folks that clear it on its own. So if it's like somebody's first positive HPV, cervix is looking good, a lot of it is like, all right, let's get the foundational things. And if you're feeling like, okay, I want to do sort of a little bit more, I really like a lot of the sort of medicinal mushrooms. Turkey tail mushroom has some great information. I know you had, we'd been chatting before about the AHCC supplement. I don't use that as much. It's kind of new. There was one study that just came out earlier this year that showed supplementing with either the study design was 3 grams a day for, I think, like 3 to 6 months. It was fairly small. I think like 10 women, and only like 5 women ended up in the final study design where they decided, okay, we need to do 3 grams a day. We need to do it for 3 to 6 months. But about 60% of those women cleared it. And those were women that had the chronic recurring HPV, not like it hadn't self-resolved within 18 months. So that's pretty interesting. It was funded by the company that makes AHCC. So it was like, it's always hard in the world to kind of navigate that research. So that's not something I've used because the research is fairly new. It's kind of a supplement that's come out in the last couple of years. But I really like the medicinal mushrooms. I think Host Defense is a great company. You can find it like Whole Foods, Vitamin Cottage. I really love their turkey tail mushroom supplement. So sometimes we'll just do like a mushroom supplement, a multivitamin that's going to be higher in the methylated B vitamins. I really like getting a good 15 to 30 milligrams of zinc. And part of it's like diet. Like if somebody's more like vegan, vegetarian, I'm going to be looking more at zinc. Usually I'll do blood work to look for things that might be impacting the immune system, like making sure people aren't anemic, making sure their B12 levels look good, making sure their vitamin D. Vitamin D is actually really important. Most of us are going to be deficient if we're not supplementing in some way. So those folks that are kind of what I would say on the lower end of the spectrum and are likely to just clear it, like even if they just hung out for 6 to 12 months doing nothing, 90% of people are going to be fine, which isn't to say like, I think what can be sort of the silver lining of a diagnosis like this is it can be sort of a flashlight or like an impetus to be like, okay, what's working in my life? What's not working in my life? So using it as an impetus to change, using it as sort of a drive to examine sort of what's working, what's not. So in those early stage folks, or folks that aren't having cervical change, it's their first kind of positive test, we're doing really basic support. For people who it's been, 18 to 24 months, they've been getting PAPs every 3 to 6 months, the HPV is persistent, then we're looking a little bit more deep at doing some of the antivirals. A lot like TORI HUDSON'S like tincture is a great one. I also like just any of the general like antiviral combinations from like a good botanical company. Host Defense I like for mushrooms, but Gaia Herbs I love for just general antiviral support. They have a couple different formulas that are just kind of broad spectrum antivirals. Higher dose vitamin C, potentially beta carotene or vitamin A. We have to be careful with the preformed vitamin A, especially if women are of reproductive age and might get pregnant in the next 3 to 6 months. Then we don't want to do high doses of vitamin A. Higher doses of methylated folate can be really helpful. And then I usually will only do suppositories for folks that are like CIN 2 and above. Sorry, I keep getting weird things on my phone. So, and again, we were chatting a little bit before we got online about it can be hard to find suppositories. The FDA is no longer allowing over-the-counter suppositories to be made. Certainly folks can attempt to make them on their own, but it is kind of a little bit of a high level home herbal preparation. A lot of the capsules, like I will occasionally have people use green tea capsules as a suppository. I really feel like, for the folks that are CIN1 and sort of below, or they just have like abnormal cells, but no of what's called AHCC, undetermined cells of undetermined significance. Their colposcopies look okay. They just have the HPV. I feel like that's pretty, of course, I would love if everybody had access to like naturopathic medicine. And in our sort of digital age, there are lots of doctors that do work virtually. So there's a lot of different ways to access care. But for folks who are kind of CIN1 and below, have the positive HPV, but really don't have a lot of other complicating factors, I feel like working on your own is super reasonable. If people are at CIN2 and above, I get a little bit nervous about folks doing, suppository routines on their own, not having somebody who can kind of look at some of those deeper issues. I'll even, for folks, maybe looking at GI microbiome, doing stool testing, things like that. CIN2 and above, we're getting into sort of some territory where I think it's really helpful to have somebody to be guiding you and to make sure that you're doing things sort of as safely as possible. Because to me, it really comes down to that blend of patient empowerment, respecting patient values, but also making sure that we're being super safe, that we're doing the appropriate follow-up. I'm never one to be like, oh, skip that colposcopy, or like, we don't need to do another biopsy. I really want to make sure we're following those guidelines. And if we get to something that's a little bit higher level, like what are the pros and cons of like LEAP versus not doing a LEAP? How much sort of time do we have? How fast does this seem to be moving? So that's kind of, because it's not, I think people have the conception that naturopathic medicine is in like direct opposition to like a more pharmacologic or surgical based approach. But really naturopathic medicine is about picking the right tool at the right time. And there's times where a surgical approach might be the right tool at the right time. And then we're talking about how do we sort of heal from that appropriately? How can we decrease scar tissue? How can we make sure that has like a minimal impact? Really, to me, the main reason to avoid LEAPs is the concern with preterm labor. So if people are like, hey, I'm at the beginning of my reproductive life, I'm planning on having kids, it's like, okay, that might be a different risk factor. If folks are like, I've had kids, I'm not interested in having kids, I'm not, worried about its impact on like reproduction moving forward. It's like, oh, okay, that might be sort of a different risk benefit analysis. So I don't feel like there's always one path or like, oh, we have to avoid intervention at all costs. It's like, what works best with you, what aligns with your patient, but what aligns with like your values around healthcare, and then like how are we being safe.
I didn't get a chance to talk to you about this in advance, but I would love for you maybe to touch quickly on the debate on like clearing the virus versus just like suppressing it into dormancy. Because I think that there is also a mindset around, oh my gosh, at any point this could just come back.
It could come back. Yeah.
Right. So how do you explain that to your patients?
Yeah, and it's hard because there is so much we don't know about viral replication, right? So there's some classes of viruses, like if you think about like the HSV, the herpes simplex virus that causes like cold sores and herpes, like genital lesions, things like that, where it's like we know that for like that category of virus, you never fully clear it. It just doesn't express symptoms anymore. It's always kind of living in your body. And if there is a decrease in sort of your immune system's ability to clear things out, it starts to express itself. HPV doesn't seem to be a sort of virus that's persistent. So it appears to be that people can like totally clear it. The problem is there's a junk ton of strains of HPV. So just because you clear one strain doesn't mean you might not be exposed to another strain, or maybe there's another strain that, you know, your body was suppressing and then that other strain comes back. So I do feel like, you know, there's some folks who they clear it never to be seen from again. And when we're doing the testing with the sort of HPV DNA probe, it's really specific. Like it's looking for like little tiny microparticles of HPV DNA. So if they're not finding any, I feel pretty confident, like, yeah, it's mostly gone. I don't necessarily think it's something that's like suppressed and comes back in a way that like other families of viruses do. That being said, we don't know everything there is to know about the HPV sort of life cycle. I've certainly seen people who've tested positive for what looks to be like the same strain multiple times, like it's gone away and then it's come back, and it always sort of shows up as that same sort of number. But it's like, and to me, it's a little bit like, you know, we're getting into kind of semantics and, you know, splitting hairs, because whether it sort of is cleared or suppressed, as long as you're not getting positive tests, it doesn't matter.
Right.
And really, you know, if it comes back and it's the same strain or another strain, again, it's that little, kind of canary in the coal mine to me of it being like, hey, something's not right with the immune system. Something's blocking your body's ability to clear this virus that for 90% of folks should be very, very clearable. So it's a little hard. I don't think even at the sort of expert virologist, sort of people who are studying HPV life cycles, that anybody can say definitively, like, yes, you clear it, it will never come back. Ideally, your immune system clears it. You have sort of memory cells that see it, and you're not going to be susceptible to that strain. But like the number of strains that we know about is like I think there's like 100+ strains at least. There's probably other strains we don't know about. How is that going to sort of change with time? So I don't have a definitive like line in the sand answer for that. My understanding is generally it's clearable in a way that not all virus families are clearable, and that once you test negative, you should be sort of clear of that particular strain of that particular virus. That being said, the human body is like a wild place, and there's always the exception to the rule, right? I hesitate to ever be like, this is 100% how it is. Right. You're always gonna, you know, there might be new research. You might be sort of an exception to that rule of clearance, and that is just kind of the way we are as humans.
I think even just having you speak to this at all and giving your opinion is going to be helpful for women to hear. So I think you nailed it the way you answered that. That was a good way of doing it. Okay, so one of the last things I want to do before I have you kind of leave us with any parting thoughts is I have had many women ask about like the more low risk strains of HPV, which typically present in the wart strain.
Yeah.
I have very little understanding of this just in my research and my knowledge. So if someone is looking to holistically try to approach that particular strain, maybe they have both, maybe they just have the low risk.
Yeah.
Is there anything different that you would suggest to these women, or is it the same mindset?
A lot of it is the same thing, and it's the same mindset. The HPV virus is the HPV virus, regardless of which type of tissue it has a preference for. So all viruses are sort of adapted to thrive in a specific environment. So the higher risk, like for example, the 16 and 18, they thrive in a cervical cell environment, which is like slightly different from like a vaginal epithelial cell environment, which is where some of the low risk strains that create like vaginal warts might live. And then there's like the HPV that causes like plantar warts or like warts on your skin. They like a different cell type. Mm-hmm. The issue is that folks that have the type of warts that are showing up as like more vaginal warts, it's like that kind of amps up that like shame, fear, freak out vibes to like 100, because you can see it and people are like, oh, you know, I'm nervous. I don't like how this looks. It's external versus internal. So it feels a little bit more like, holy moly. The same theory applies though. Like HPV clearance is HPV clearance regardless of what cell type what cell structure we're looking at. Okay. So a lot of the basics are in line. The majority of folks are going to clear those type of lesions on their own within 12 to 18 months. Given sort of a solid immune system. A lot of the topical treatments, again, when we're thinking about how to get rid of lesions on kind of sensitive skin types like the vaginal tissue, a lot of like the online remedies, they're basically just trying to burn them off, but they're burning them off with like topical things like essential oils or vinegar, things like that. Versus in an office setting, you might use you might freeze them off or apply a topical chemotherapeutic agent. And sometimes when people think like, chemotherapeutic, that sounds like chemotherapy. That sounds like it must have like a lot of terrible side effects, like when we're treating cancer. But chemo just stands for chemical, and therapeutic just means like chemical that has a therapeutic, like a cell killing off effect. So there's a lot of the medications that you do topically. They're basically just like killing those local cells to sort of break down the growth so it kind of dies, and then the immune system can chomp it up a little bit more effectively. There is a cool medication. There is a green tea ointment that is a prescription that seems to work really well and not damage the other tissues. Some people have luck with silver gel. Okay. So like a hydrolyzed like silver gel. There's a company I like, Argentin 23 does a silver gel. That's really safe to do. Any of like the essential oils like thuya or tea tree, the only concern there is they can really burn. I've seen people really burn their vaginas applying like essential oils or like vinegar. So you just want to be cautious. And again, when it comes to like, all right, I want to remove these lesions ASAP. They're giving me a lot of mental, emotional stress. I don't feel great about them. I don't want to wait 12 to 18 months for my body to clear it on their own. Sometimes I think accessing those like conventional tools of having them like frozen off or removed, or getting a sort of prescription, which is just like a topical that's going to like address that specific lesion while doing some of the underlying stuff, I think is a reasonable way to do it. Again, a lot of people don't want to access care because they're feeling like ashamed about it. They have fear about it. They're embarrassed to talk to their healthcare provider. And they're like, I just want to do something in the comfort of my own home so nobody has to know. But I assure you, it's like just another day in the office. I worked in, during my residency, I worked at like a sexually transmitted infection drop-in clinic in Portland. And it's like literally all we did every day was just like burn people's warts off. It was like, do treatment, go hang out. It's like nobody's sitting around being like, oh my God, I saw this patient today and they had like genital warts and I was like so shocked and like what a bad person. It's like just another day at the office. So if what's keeping people from accessing that care is that they have kind of that shame about it or fear, it's like, just let that go. And if what's best for your mental health is to just get rid of those lesions ASAP, that might be the quickest way to do it. If you want to sort of give your body time, do some of that immune support, pretty much any of the protocols that would work for cervical HPV are going to work for genital warts. And if you wanted to do, experiment with some topicals, I would just say like, be careful not to burn your vagina because it hurts to do so. And that tissue is very sensitive. So just being careful of like applying undiluted essential oils and really monitoring for any like burning, pain, things like that. It shouldn't be a super painful process.
Okay, excellent. I think that's going to be helpful for women to hear. Again, it does sort of circle back to there tends to be a mindset of all or nothing, one mindset of like all Western approach, just cut it off, versus I can't do that. Let's go as least invasive as possible, all natural. But sometimes it is appropriate to do a little bit of both, right?
And I think really, part of, to me, a holistic approach is not saying, oh, it has to be 100% this or 100% that, because that can be really based in like judgment and fear and the idea of doing something perfectly. Like there's that perfectionist piece that really holds people back. I want to look at it from like the whole picture, like what is going to get you sort of the results you need in a time frame. When it comes to genital warts, people can be so frozen in fear and like feel so bad about it that it's going to impact them, every day for months. And it's like, just if it's bugging you that much, like maybe the fastest route or that's okay while you work on the underlying stuff.
Right.
We always want to look at things like what's, financially available, what again fits in with your value system. But I think it should be based off of kind of this like shared decision-making, risk benefit analysis versus like, I need to do this the perfect way or the natural way, or I don't want to access healthcare because I'm like scared of being judged, things like that. I think it should really be, what makes the most sense and what's like grounded in that knowledge piece versus trying to do something like a specific way. Like I said, there's like no gold stars for getting it right. It's just doing what works for you. And what works for you now might be different 3 months from now. It doesn't have to be static. It can kind of change and grow as the person changes and grows or has different circumstances.
Wonderful. Well, while you have a platform here, you've got everyone's eyes and ears. You got lots of women staring at your face right now. What do you want these girls to know?
I feel like I've covered a lot of it, but really I go back to releasing that fear, releasing that judgment, and just kind of, I like to say, going back to this principle of being like a neutral observer. Like, what are the facts? What do we know to be true? How do we want to move forward? But letting go of any sort of judgment, negative self-talk, fear, wanting to do things, quote unquote, the right way, and just letting that part go and checking in and seeing like what feels right to me and how should I move forward? What's like a nice plan that feels doable, that feels approachable? What are my timelines? Like often for patients, I'm like, hey, let's do this for 3 months. If it doesn't work at that point, maybe we want to reevaluate versus kind of this spiraling or today I'm going to do this, tomorrow I'm going to do that. It's really slow changes over time that help our health. And understanding that for the vast majority of people with HPV, time is totally on your side. It's not a rush. It's not typically something that's super aggressive. So, pick a plan, stick with it, reevaluate it at specific intervals, but let it be, let it be a little lighter. Let it not dominate your life. Still be having fun. Still be like not having it be like, this is my, whole identity and I have to spend every second of my life like fighting it. It's like, we don't want to fight. We just want to like gently encourage it to like check out other ecosystems, right? Like,
I thought that your what you shared about laughter was was really beautiful. I'm imagining women sitting on the couch watching Friends and their husbands coming home and they'd be like, shh, I am doing my medicine right now.
I am laughing right now.
Right.
Don't you dare turn on the TV. No news, no social media. I am just like checking out and relaxing and stimulating my immune system by having these like positive emotions.
Good. Love it. Well, Doc, thank you so much for everything you do for women here in Colorado. I feel very lucky we got a chance to have this talk. Yeah, absolutely. It was a pleasure having you. And I guess I'll let you head off the rest of your day from here. But thanks so much. I really appreciate the time today.
You're welcome. Bye.
All right. Thanks, Doc. Bye.